Started to look into how we could help young people with their mental health, because we were noticing that there was a lack of services we could refer people into. A lot of this work started within the Wharfdale community, and Wharfdale is a patch at the top of Bradford. We part of the same CCG, Bradford and Craven, and we're at the top of Bradford, and there were a lot of services for children, but they were in the centre of Bradford or in Keighley. Our children couldn't access them, it was too far geographically, or the services weren't open to them. We were noticing more and more that people were attending the surgery just because they were unhappy and they didn't know what to do about it. And that amount was probably increasing from about 2014, 2015. It seemed to be going up massively. And we used to have school nurses that we would do everything to, and they would refer people onto CAMS, child and adolescent mental health services, or they would offer low-level intervention, and it was working quite well until then. And then I think when austerity happened, a lot of budgets were cut, and school nursing comes, as far as I understand it, under public health. Public health is funded with local councils rather than the health service, and again they cut some services. And the area at the top of Bradford, Wharfdale, which I'm part of, because it's seen as the most affluent area of the patch, we got our school nurses services basically removed. We are attached to another area, but it's really hard to get hold of school nurses. So we've gone from having a service that was really interventional, would go into schools quite regularly, was there as a good first point of call for basic medical problems, but also mental health services, to that not being available. So we were struggling with that. Where did we send people if there was no school nurses? So from my personal point of view, austerity was a disaster for the NHS, and children's mental health services really suffered with that because of the lack of resources given to things like school nurses, the lack of funding into mental health services, and that's created this crisis that is so behind what we need. So I think that's a big key. We can't expect services to be there if we don't invest in them. And if we don't invest in children, then they become a missed generation. We have such a capacity to help children when they're in that schooling system, when they're living at home with their parents, they're at school. That is the time to help them with mental health issues so that they can leave home, get jobs, become fully functioning adults. And I feel that there's a raft of children who we've missed that opportunity with them, often because they've developed problems with school refusal. We haven't been able to get them seen by the mental health services. If there's a 2-year wait for something and you're 14, that 2 years is really important. And often we've had experiences of mental health teams discharging children because they've said they didn't engage. But I would say that challenge should come back to us in the health service. If children aren't engaging with what we're offering, we should offer them something different. They're children. It's partly their job as teenagers to be difficult and non-engaging. And I'm sure those of us who either have children who remember being teenagers, that's what teenagers are like. And we can't, I do worry that they are difficult. And it's easy for us to write them off, to say, well, they're not interested in what we have to offer. But we've lost then that opportunity. And then they're the people I see in their 20s who haven't been able to stay at university, are really struggling to find a job, have gone back to living at home. And then they do really become depressed, feel that life has nothing to offer them. And I worry that that is becoming more problematic since the pandemic.